Over the years, we've had some very strange cases of back pain. This is probably the strangest case that we've ever had. We had a 40-year-old male present to us in a wheelchair, having suffered back pain for 3 years. It had got to the point now where it was very, very sharp, severe, and unbearable. The man in this picture is not the man that presented to us. It's just for illustration purposes. Along with the severe back pain he was suffering with, he was also reporting pins and needles below the knees, also known as paresthesia, no feelings in his feet, and he had digestive issues with going several days without a bowel movement, but his bowel was also weak and his bladder was weak, so they could let go at any time, even though he wasn't going frequently. The most unusual thing about his presentation, and the reason he was in a wheelchair, was that he'd been shot 10.5 years earlier before presenting to us. And the bullet had lodged in his spine, and he was told that he would have to stay in a wheelchair because any movement could dislodge the bullet and it could cause him paralysis. So he was quite understandably very scared about moving out of his chair. When people come to see us with back pain, if they've had any sort of surgical procedure, trauma, or any kind of odd event happening to their spine, we always take an X-ray to find out what is going on the inside. And in this case, of course, we did have to take an X-ray to find out what was going on with this bullet and what was happening to his spine. So we did take an X-ray, and when we looked at the lateral view of his lumbar spine X-ray, we did see that there was a bullet lodged, or seemingly lodged, in L4. The only curious thing about it was that there was no destruction of the bone whatsoever. So there appeared to be a bullet lodged in the spine without any sort of entry damage into the spine. And this did really pique our interest, as it was very odd to see. If you're wondering where the bullet is, it's this white density overlying the L4 vertebra, marked out by this red arrow. When you use X-rays to diagnose problems in the body, you always have to take two views, because X-ray imaging is a two-dimensional imaging modality, and you need to build an impression of what you're seeing in 3 dimensions by taking the second X-ray. And when we took that X-ray, to our surprise, the anterior to posterior X-ray showed that the bullet was nowhere near the spine. We can only assume that when the X-rays were originally taken, only a lateral lumbar X-ray was taken, so it appeared that the bullet was lodged in the spine. But when we look at the proper diagnostic X-rays, where you take an anterior to posterior view as well, and this is marked out with the red arrow here, you can see that the bullet is at least 15 centimeters away from the spine. It's no way near it. So this person had actually spent 10.5 years in a wheelchair for no purpose whatsoever, as he was under no risk of that bullet dislodging and affecting his central nerve system or his peripheral nerve system in any way, shape or form. Because the bullet presented as no risk to him whatsoever and his anatomy was basically absolutely normal, we were able to accept him for care. And I'm very happy to say that after 2 months of our care, he rated his pain as a 0 on a scale of 10, where he'd rated it as an 8 out of 10 when he originally came to see us. We really love to help people to get better, especially people that have been failed before or have tried everything else to get better and nothing's worked for them. So if you suffer with any sort of physical pain, whether it's back pain, neck pain, sciatica, headaches, migraines, it doesn't really matter, then we pride ourselves in finding the problem that's causing your pain and helping you to get rid of it. Just send us a message, give us a call, or leave us your detail on our website, and we'll be happy to help you to get better.